Remember when the Justin Trudeau Liberals claimed to be following the science by disregarding bodily autonomy and informed consent and forcing every public sector employee to be indiscriminately COVID-19 vaccinated with a novel, still in clinical trials injection? Well, they have had to pay out hundreds of thousands of dollars to the unvaccinated as a result.
Like any modern bit of medical advancements, there are potential side effects in vaccinations. And there are people who've probably gotten very sick from vaccinations, on the billions of people who've been vaccinated against COVID over the past few years. But there are far more people who obviously have died due to COVID, died from not getting vaccinated. And the idea that people can fly in the face of science, well, individuals are allowed to make their own choices. There may be all sorts of different reasons why someone is hesitant to get vaccinated. But I make a distinction, and I have always have, between someone choosing for personal reasons to choose not to get vaccinated and someone deliberately using misinformation to mislead and scare other people with so-called facts that aren't facts at all, that lead them to make a choice that endangers their lives and the lives of other citizens.
For Rebel News, I'm Tamara Ugolini to show you responses from various federal government departments detailing just how much money they have had to pay out to ousted public servants over their indiscriminate enforcement of COVID-19 vaccine mandates. In an order paper question penned by Conservative MP Ted Falk, he requested that the government detail how much they spent on compensation, severance, and settlements related to the COVID-19 vaccination requirement for public servants, including payments to mediators, lawyers, and employees, alongside a breakdown in reasons for these payments. The Department of Fisheries and Oceans paid out nearly $116,000 to 4 employees, $7,500 in damages, and over $23,000, almost $39,000, and over $46,000 in salary reimbursements, while those public sector employees were on administrative leave without pay. Global Affairs Canada paid out over $88,000 to 4 employees, again for repayment of salary during the period that the employee was on leave without pay for non-compliance with the vaccination policy. The Public Health Agency of Canada paid out almost $22,000 to 1 employee for salary reimbursement. And then Health Canada, which is the agency responsible for national health policy, surprisingly had the largest payout of the government departments listed. They paid out almost $188,000 to 11 employees for failure to comply with the COVID-19 vaccine mandate. All employees received reimbursement of salary lost while on administrative leave without pay, ranging from $2,000 to nearly $28,000 in compensation. This comes up against the discovery that billions of taxpayer dollars were wasted on expired and or donated COVID-19 vaccines, and over $11 million have been paid out to a mere fraction of vaccine-injured Canadians seeking relief from the pandemic-borne Vaccine Injury Support Program. All of this perpetuates the alarming trend of frivolous spending and careless administration by the Liberal government, which is only exacerbated by the coercive COVID-19 vaccine program that relied on intense psychological operations to nudge citizens into compliance.
I think, coming back to evaluation and science, I think it's important when applications are being stood up that there is an actual integrated evaluation and research aspect to them. Otherwise, you have no idea whether they work or they don't work. So maybe government can at least play a role in that space. We've certainly seen a growth of these applications, and we have our own applications too that nudges people and reward them for healthy behaviors or giving them badges or these kind of rewards. And I don't see people doing that research as much as we would like. So maybe I'll turn it back to chief science officers to see if they can help. But I think regulation of social media platforms is the one that governments have been really engaged in, and that's quite a massive piece of space of regulation that is still undergoing debate.
For Rebel News, I'm Tamara Ugolini. If you're tired of hearing about the fallout of these novel injections, then you can visit our website at nomoreshots.ca, where we are calling on Federal Health Minister Mark Holland to revoke market authorization for these products. Find out all about that, sign our petition, support our work, and send him a form email at nomoreshots.ca.